Did you know that high blood pressure is called the silent killer for a reason? You might feel perfectly fine, no headaches, no dizziness, yet your heart, arteries, and even your brain could be suffering serious damage right now. So, how can you tell if your blood pressure is dangerously high before it's too late? In this video, we're uncovering the shocking truth about blood pressure, what it really means, why it's more dangerous than most people realize, and how new guidelines have suddenly redefined millions of people as hypertensive overnight. Right arrow, do you know what your blood pressure numbers really mean? Right arrow, why did doctors change that safe limit, and should you be worried? Right arrow, what happens when blood pressure gets too high, or even too low? Right arrow, is high blood pressure inevitable with age, or can you prevent it? And most importantly, right arrow, what simple steps can you take today to protect your heart, brain, and kidneys for years to come? Light bulbs, stay with us until the end because your life could literally depend on it. We're not just sharing facts, you'll also learn life-saving habits, expert-backed strategies, and easy ways to take control of your health before it's too late. Red circle, don't ignore the warning signs. Don't let high blood pressure steal your future. Loudspeaker, watch now and take action. Your heart will thank you. If you haven't subscribed to our channel yet, I encourage you to click the subscribe button and ring the notification bell to stay updated on all our latest content. I'm eager to hear your thoughts on today's topic. If you enjoy the content, please comment 1 below. If it doesn't resonate with you, leave a 0. Your feedback is crucial as it helps me create better videos that align with your interests. Now, let's get started. What is blood pressure and why is it important? Your heart beats tirelessly, day and night, without rest, keeping you alive with every contraction. It pumps oxygen-rich blood through an intricate network of arteries, nourishing every organ, tissue, and cell in your body. But have you ever stopped to consider the pressure your blood exerts against the walls of those arteries? That force, known as blood pressure, plays a pivotal role in determining whether your body functions smoothly, or whether you're silently heading toward a health crisis. Think of your arteries as highways, and your blood as a steady flow of traffic. When traffic moves at a controlled pace, everything runs smoothly. But when the pressure builds, like congestion on a busy freeway, disaster looms. High blood pressure, or hypertension, forces your heart to work harder than it should, putting immense strain on your arteries and vital organs. Over time, this relentless stress can cause irreversible damage, leading to heart attacks, strokes, kidney failure, and even memory loss. Yet, what makes high blood pressure particularly dangerous is that it often has no noticeable symptoms. You may feel perfectly fine, unaware that your body is struggling under an invisible burden. It's called the silent killer for a reason. By the time symptoms appear, serious damage may already be done. Understanding blood pressure readings. When you get your blood pressure checked, you're given 2 numbers, each telling a critical story about your heart's workload and your overall cardiovascular health. Systolic pressure, top number. This measures the force of blood against your artery walls when the heart contracts, sending blood surging through your vessels. It represents the highest pressure in your arteries. Diastolic pressure, bottom number. This reflects the pressure in your arteries when your heart is resting between beats. It indicates how well your arteries relax and handle blood flow when the heart isn't actively pumping. For decades, healthcare professionals have relied on these 2 numbers to assess cardiovascular health. But in 2017, the medical world was shaken when the American College of Cardiology, ACC, and the American Heart Association, AHA, unveiled new guidelines that changed how we classify high blood pressure. The shocking new blood pressure guidelines. In a landmark decision, health experts lowered the threshold for what constitutes high blood pressure, redefining millions of Americans overnight. Previously, 140/90 mmHg was considered the danger zone for most adults, while older adults over 65 were given more leeway with a cutoff of 150/80 mmHg. But new research exposed a harsh truth. Even slightly elevated blood pressure significantly increases the risk of heart disease, stroke, kidney failure, and early death. Under the new guidelines, 130/80 mmHg or higher is now considered high blood pressure for everyone, no exceptions. This means that millions of adults who once thought their blood pressure was normal are now classified as hypertensive. These changes weren't made on a whim. Decades of research revealed that even mildly elevated blood pressure can silently damage the arteries, weaken the heart, and increase the likelihood of fatal cardiovascular events. The message is clear. Stop sign: there is no such thing as mild high blood pressure. Even slightly elevated readings demand attention. What do these numbers mean for you? The new classification breaks blood pressure readings into 4 distinct categories. Normal blood pressure, below 120/80 mmHg, your heart and arteries are in optimal condition. Keep up the healthy habits. Elevated blood pressure, 120 to 129 systolic and below 80 diastolic, a warning sign that your blood pressure is creeping up. This is the time to make lifestyle changes before it progresses. Stage 1 hypertension, 130 to 139 systolic or 80 to 89 diastolic. Your heart is now under consistent stress, increasing your risk of heart disease. Immediate action is needed to prevent complications. Stage 2 hypertension, 140 plus systolic or 90 plus diastolic. Your cardiovascular system is at serious risk. Without intervention, you could face a stroke, heart failure, or organ damage. If you are still watching this video and find these lessons useful, please comment number 1 below to let me know that you are still watching this video with me. If you are over 65, these new guidelines may be especially concerning. For years, a systolic reading of 140 millimeters of mercury was considered acceptable for older adults. Now, that very number could classify you as hypertensive, placing you at risk of lifelong medication, lifestyle overhauls, and medical monitoring. Loudspeaker, this is a wake-up call. The numbers don't lie. Your heart needs protection, and action starts today. Why you should take high blood pressure seriously. Blood pressure doesn't just affect your heart, it impacts every organ in your body. Over time, uncontrolled hypertension can lead to catastrophic consequences. Broken heart attack, and heart failure. Elevated blood pressure forces your heart to work harder than it should. Over time, the heart muscle thickens and weakens, making it harder to pump blood efficiently. This can lead to heart failure or sudden cardiac arrest. Brain stroke and brain damage. High blood pressure is the leading cause of strokes. When arteries in the brain become narrowed or blocked, a stroke occurs, potentially leaving permanent brain damage, paralysis, or even death. Drop of blood kidney failure. Your kidneys filter waste from your blood, but they rely on healthy blood vessels to do their job. High blood pressure damages kidney arteries, leading to kidney failure, a condition that may require dialysis or a transplant. Eye vision loss. Hypertension can cause retinal damage, leading to blurred vision, vision loss, or even permanent blindness if left unchecked. Leg aneurysms and artery damage. The constant strain from high blood pressure weakens arterial walls, making them prone to bulging, aneurysms. If an aneurysm bursts, it can be instantly fatal. Police car-like dementia and cognitive decline. Emerging research suggests a strong link between hypertension and Alzheimer's disease. High blood pressure may contribute to vascular dementia, accelerating memory loss and cognitive impairment. The bottom line: ignoring high blood pressure is like ignoring a ticking time bomb. It may be silent for years, but when it explodes, the consequences can be life-altering or fatal. Take control of your blood pressure today. The good news: high blood pressure is manageable. Small, consistent changes can dramatically improve your heart health and add years to your life. Heavy check mark: monitor your blood pressure regularly. Knowledge is power. Get a home blood pressure monitor and check your readings frequently. Heavy check mark: adopt a heart-healthy diet. Reduce salt, processed foods, and sugar. Focus on fruits, vegetables, lean proteins, and whole grains. Heavy check mark: exercise regularly. Aim for at least 30 minutes of moderate activity most days of the week. Walking, swimming, and yoga can work wonders. Heavy checkmark, limit alcohol and caffeine. Both can cause spikes in blood pressure. Moderation is key. Heavy checkmark, manage stress. Chronic stress raises blood pressure. Try meditation, deep breathing, or hobbies that bring you joy. Heavy checkmark, take medications as prescribed. If your doctor prescribes blood pressure medication, take it as directed. Skipping doses can be dangerous. Your life is worth protecting. Blood pressure isn't just a number, it's a lifeline. It's a direct reflection of your heart's ability to sustain your body. You have the power to take control. Don't wait until high blood pressure steals your health, your independence, or your future. Start today because your heart and your life depend on it. Does blood pressure naturally increase with age? Many older adults ask, isn't my blood pressure supposed to increase as I age? The short answer is yes. It is normal for blood pressure to rise with age due to factors like arterial stiffness. As we age, blood vessels lose flexibility and become stiffer. Hormonal changes. These can affect how the heart and arteries function. Declining kidney function. The kidneys play a crucial role in regulating blood pressure. Because of these natural changes, many doctors hesitate to aggressively lower blood pressure in elderly patients. The main concern is the risk of hypotension, which can cause dizziness, fainting, falls, confusion, and increased kidney problems. Key studies on blood pressure control. The SPRINT study, 2015. This study included 9,300 people aged 50 and older who were at high risk for cardiovascular disease but did not have diabetes, dementia, or a history of stroke. The average age was 68 years. Participants were divided into two groups. Standard therapy group, target systolic blood pressure of 140 millimeters of mercury. Intensive therapy group, target systolic blood pressure of less than 120 millimeters of mercury. After 3 years, researchers found that the standard group had a 2% rate of major cardiovascular problems per year. The intensive group had a 1.65% rate per year. This means that those aiming for a systolic pressure below 120 millimeters of mercury had fewer cardiovascular events. However, they also experienced more side effects, including hypotension, acute kidney injury, and electrolyte imbalances. The CHART study, 2021. This study analyzed 20,000 Chinese adults aged 60 to 80. It compared intensive treatment, target systolic below 130 millimeters of mercury. Standard treatment, target systolic below 150 millimeters of mercury. Results showed that a target of below 130 millimeters of mercury significantly reduced the risk of major cardiovascular events, particularly strokes, compared to a more conservative goal of below 150 millimeters of mercury. However, just like in the SPRINT study, aggressive treatment increased the risk of hypotension and kidney complications. What should older adults aim for? A personalized approach is the best method. If you are still watching this video and find these lessons useful, please comment number 2 below to let me know that you are still watching this video with me. The SPRINT study indicated that a target systolic pressure of around 120 millimeters of mercury can reduce heart disease and stroke risk. However, not everyone can tolerate the medications needed to reach this level. If blood pressure is too low, it can lead to dizziness, exhaustion, falls, or kidney issues. For frail older adults or those with multiple health conditions, a goal of below 140 or 150 millimeters of mercury may be more appropriate. This slightly higher target can reduce the risk of hypotension and other complications. The role of lifestyle changes. Medication is important, but lifestyle changes are also crucial for controlling blood pressure. Key lifestyle adjustments. Balanced diet include fruits, vegetables, whole grains, and lean protein. Reduce salt intake, avoid processed foods and limit added salt. Regular exercise, light activities like walking, swimming, or aerobics help. Maintain a healthy weight. Every pound lost can help lower blood pressure. Limit alcohol. Women should have no more than 1 drink per day, men no more than 2. Manage stress. Techniques like meditation, deep breathing, and yoga can help. These lifestyle changes can reduce the need for medication or lower the required dose. How to measure blood pressure correctly. 4 accurate readings. Measure at the same time each day, such as before breakfast or before taking medication. Sit quietly for 5 minutes with feet on the floor and back supported. Use a properly calibrated home monitor. Take 2 to 3 readings, 1 minute apart, and average the results. Some older adults experience white coat hypertension, high readings in a doctor's office due to anxiety, or masked hypertension, normal readings at the doctor but high at home. A home blood pressure monitor can help detect these situations. When to seek medical attention. If systolic pressure is continuously above 170 millimeters of mercury or diastolic pressure is above 100 millimeters of mercury, medication is strongly recommended. If you have headaches, chest pain, shortness of breath, or confusion, you may be experiencing a hypertensive crisis. Seek medical help immediately. If you feel dizzy or extremely fatigued, check if your blood pressure is too low, below 90/60 mmHg. The bottom line. Everyone is unique. Work closely with your doctor to determine the best blood pressure goal for you. Instead of strictly following a universal number, consider your personal health history, your ability to tolerate side effects, lifestyle changes to support healthy blood pressure. Finding a balance between preventing serious cardiovascular events and avoiding new health risks is key. Talk to your doctor about what works best for your individual needs. Personalized blood pressure management for older adults. In 2017, blood pressure guidelines were updated, establishing 130/80 mmHg as the new threshold for hypertension in all individuals, including those over 65. While studies like SPRINT and CHART suggest that strict blood pressure control can lower cardiovascular risks, they also highlight potential dangers, especially for older adults. For some seniors, it may be safer to aim for a blood pressure below 140 or even 150 millimeters of mercury, considering natural aging changes. Although concerns exist about medication side effects and the risks of taking multiple prescriptions, polypharmacy, the cardiovascular benefits of lower blood pressure should not be ignored. Lifestyle adjustments for blood pressure control. In addition to medication, lifestyle changes play a critical role in maintaining healthy blood pressure levels. Healthy diet. Consume fruits, vegetables, whole grains, and lean protein. Follow the DASH diet, which reduces sodium and promotes heart-healthy eating. Reduce salt intake. Lower sodium consumption to help manage blood pressure. Avoid processed foods, canned soups, and excessive table salt. Regular physical activity. Engage in light exercises like walking, swimming, or yoga. Even moderate, consistent movement can be beneficial. Maintain a healthy weight. Losing excess weight helps lower blood pressure. Every pound lost can reduce strain on the heart. Limit alcohol consumption. Excessive alcohol raises blood pressure. Limit to 1 drink per day for women and 2 for men, though guidelines may vary. Manage stress. Chronic stress can elevate blood pressure. Practice meditation, deep breathing, or light yoga to calm the body and mind. These simple but effective habits can reduce the need for medications or allow for lower doses while maintaining blood pressure control. The importance of proper blood pressure measurement. For accurate blood pressure monitoring, follow these tips. Measure at the same time daily, e.g., before breakfast or medication. Sit quietly for 5 minutes before taking a reading. Use a reliable home blood pressure monitor that is well calibrated. Take 2 to 3 readings with a 1-minute gap and average the results. Some people experience white coat hypertension, high readings at the doctor's office due to anxiety, masked hypertension, normal readings at the doctor but high readings at home. A home blood pressure monitor can help provide a more accurate picture of your daily blood pressure patterns. When to seek medical attention. It is important to recognize warning signs and seek medical help when needed. If systolic pressure is consistently over 170 millimeters of mercury or diastolic over 100 millimeters of mercury, medication is highly recommended. If you experience headaches, chest pain, difficulty breathing, or confusion, this may indicate a hypertensive crisis. Seek immediate medical attention. If you feel dizzy, weak, or overly fatigued, check if your blood pressure is too low, below 90 over 60 mmHg. Sometimes, well-intentioned but overly aggressive treatment can lead to hypotension, low blood pressure, which can be just as dangerous, especially for older adults prone to falls. The key takeaway: finding balance in your health journey. Your health is not just a set of numbers on a chart. It's not about blindly chasing a single blood pressure target or fitting into a medical guideline designed for the masses. Your health is personal. Your journey is unique. That's why finding balance is essential. Achieving optimal blood pressure isn't just about lowering a number. It's about protecting your heart while maintaining your quality of life. It's about making choices that allow you to feel strong, energized, and in control, rather than merely existing under the weight of rigid medical targets. To truly achieve this balance, consider the following personalized factors when working with your doctor. 1. Your personal health goals. Do you prioritize mobility, strength, and energy, or are you more comfortable aggressively lowering your blood pressure, even if it means potential side effects? Would you rather walk with confidence and maintain independence, or strictly follow a regimen that may leave you feeling drained? What matters most to you, adding years to your life, or making the years you have more vibrant and fulfilling? If you are still watching this video, and find these lessons useful, please comment number 3 below to let me know that you are still watching this video with me. 2. Tolerance to medication side effects. Medications can be life-saving, but they can also come with challenges. Are you willing to accept mild dizziness, fatigue, or muscle weakness in exchange for a lower risk of stroke or heart failure? If medication makes you feel sluggish or limits your ability to enjoy daily activities, is it worth reconsidering the dosage or exploring alternative strategies? Some people feel fine with a lower blood pressure, while others feel lightheaded, tired, or even mentally foggy. Which side do you lean toward? 3. Lifestyle adjustments over medication reliance. Can you adjust your diet, increase physical activity, and manage stress to naturally bring your blood pressure down? Are you willing to cut back on sodium, embrace heart-healthy foods, and move your body daily instead of relying entirely on medication? For some, lifestyle changes are enough. For others, medication is necessary, but the best results come from a balanced approach. By working with your doctor, not just as a passive patient, but as an active participant in your own health, you create a plan that is sustainable, personalized, and effective. You are not just a statistic in a medical study. You are a human being with unique needs, preferences, and goals. Final thoughts. Making sense of the new blood pressure guidelines. The 2017 blood pressure guidelines brought significant changes, lowering the threshold for hypertension to 130/80 mmHg for all adults, including those over 65. This shift was based on groundbreaking research that showed even mildly elevated blood pressure increases the risk of stroke, heart attack, and other cardiovascular diseases. But while these changes were made with good intentions, to reduce preventable deaths, they also introduced new challenges for older adults. What the research says. Pushpin studies like SPRINT and CHART confirm that stricter blood pressure control reduces cardiovascular risks, but they also show that overly aggressive treatment can lead to increased side effects, such as dizziness, falls, and kidney complications. Pushpin for some older adults, a slightly higher blood pressure target, below 140 or 150 millimeters of mercury, may actually be safer, considering natural changes that come with aging, such as stiffer arteries and altered kidney function. Pushpin polypharmacy, taking multiple medications, is a growing concern for seniors. Adding more blood pressure medications to an already long list of prescriptions can increase the risk of drug interactions, excessive drops in blood pressure, and harmful side effects. The power of lifestyle changes. While medication plays a crucial role in blood pressure control, lifestyle choices are often just as, if not more, powerful. Many doctors now encourage holistic, sustainable approaches to maintaining heart health, including heavy checkmark A heart-healthy diet, reduce sodium, processed foods, and sugars while increasing potassium-rich foods like leafy greens, bananas, and sweet potatoes. Heavy checkmark regular exercise, daily movement, even a brisk walk, can significantly lower blood pressure and improve overall well-being. Heavy checkmark weight management. Losing even a small percentage of excess weight can dramatically reduce blood pressure levels. Heavy checkmark stress reduction, meditation, deep breathing, social interaction, and enjoyable hobbies lower stress hormones that can contribute to high blood pressure. Heavy checkmark proper hydration. Staying well hydrated helps keep blood vessels flexible and prevents unnecessary strain on the heart. Heavy checkmark home blood pressure monitoring. Regularly checking your blood pressure at home helps detect hidden hypertension and ensures more accurate readings than occasional doctor visits. The key is balance. Ultimately, the goal isn't just to lower a number, it's to strike a balance between reducing cardiovascular risks while avoiding additional health problems. It's about tailoring a plan that fits your unique body, your lifestyle, and your long-term well-being. Your doctor can guide you, but the most important voice in this journey is your own. You have the right to ask questions, to express concerns, and to advocate for a treatment plan that prioritizes both longevity and quality of life. What you can do today. Pushpin talk to your doctor about your personalized blood pressure target based on your age, health conditions, and lifestyle. Pushpin discuss the risks and benefits of medication, and consider alternative approaches if needed. Pushpin adopt heart-healthy lifestyle changes to naturally improve blood pressure and overall health. Pushpin monitor your blood pressure at home to ensure you're getting the most accurate readings. Pushpin make informed decisions that align with your well-being, not just a rigid medical guideline. Because at the end of the day, it's not just about numbers, it's about feeling well, living fully, and protecting your future. Backhand index pointing right. Your heart is your most vital organ. Take care of it, and it will take care of you. We've covered a lot of important information in this video. What blood pressure really means, why new guidelines have changed everything, and most importantly, how you can take control of your health before it's too late. Now, we want to hear from you. What is one thing you've learned today that you will apply to your life? Maybe it's checking your blood pressure more often, making small diet changes, or simply being more aware of your numbers. Drop a comment below and let us know. Speech balloon your thoughts could inspire someone else to take action, too. And if you found this video helpful, please give it a thumbs up, share it with your friends and family, and don't forget to subscribe to our channel for more life-changing health insights. Hit that notification bell so you never miss an update. Your heart, your health, and your future depend on it. Loudspeaker, thank you for watching. Stay healthy, stay informed, and we'll see you in the next video. Rock it!